Thank you for joining me. Today, actually, I'm very excited with person I'll be interviewing today. I've known Dr. Grossman for more than 10 years. She is my friend, but also my dermatologist. And she is a great person. And before we go straight into the questions that I have for her, I'd just like to give you a little bit of a bio. Dr. Grossman is internationally renowned. She's a board certified dermatologist with offices in Santa Monica and New York. Dr. Grossman had a fellowship at Harvard University and was one of the very first medical professionals in the world to be trained in cosmetic laser treatment. She has a following of celebrity patients. I don't know if I'm considered one of them.
Of course you are.
Thank you. She is a published author and has her own skincare line, Karyn G. Now, this is a quote from Dr. Grossman. As a cosmetic dermatologist, I have two duties that never get old. One, educating my patients, and two, addressing ways they'd like to turn back the clock. Now, that is absolutely spot on, because the first time I came to see you, you told me, Lamise, you have great skin. And I said, of course I do. Yeah, I have my own skincare line. Of course I do.
Yes.
But you also said, what I want to do is build up your collagen. So we're going to do a few lasers, a few things that build up your collagen. So you might not see a huge difference now, but when my aim is what you said, my aim is, Lamise, for you, that when you're 60, you still look like what you look like now. And I have to say, I look great. I'm 49 years old, almost 50, and I have nice, thick skin that comes back. It's spongy, it's elastic. And I would say 30 to 50% of why it is like this is because of your treatment, the lasers that you've done for me, the microneedling that you've done for me. Yes, the other 50% is genes, a good skincare routine, a good diet, and sunscreen maybe would play a very big role in that as well. But, don't discount lasers either. So what I want to talk to you, because I know it's been 12 years and there are so many new advances, when we're talking about collagen and elastin, and let me say just one more thing before I begin as well. A lot of people tend to think, oh, in 10 years, I'll just get a facelift or I'll do treatments. Well, if you have good skin to begin with, your results, even if you want to go invasive, are going to look fantastic. So
Yes.
it is important for those who are more natural like me and those who aren't, and that's fine as well. But having a good skincare base or skin base is really important. So nowadays, and you're always on the cutting edge, what promotes collagen and elastin? And let's start off with the least invasive to the most invasive procedures in your mind.
So I think when we think about collagen production, we need to think about the layers in the skin and where are we promoting collagen. And I think we want to think about kind of either from top down or from bottom up. So when I think about patients, I think about things as kind of a holistic view that way. So one of the things we think about with promoting collagen is skincare. And as you know, you have your own skincare line, you came in taking good care of your skin, and that is always priority number one. So when we think about what we do, we're feeding our skin every day with skincare that provides those basic building blocks for what our skin, we're nourishing it and we're feeding it, and we're doing that on a daily basis. And sunscreen and staying out of the sun is going to be number one priority for that. And then we want to think about what we're going to do kind of deep down building of collagen in our skin. So we have the top of we have our skin, and then we have strands of collagen that connect our skin to structures below, or what we call the fibroseptal network, or the FSN. And keeping that FSN strong and those collagen strands strong and built up is what helps to keep our face still strong and lifted, right? And we've been working on that now for about 20 years through a variety of different procedures. And we know that building collagen in that deep layers helps keep us looking younger longer. So we have a variety of different technologies that we can do for that. And we can look at radio frequency, and we can look at ultrasound. Those tend to be the two kind of categories that we'll look at. So 20 years ago, we started off with thermage, and thermage still works, and it has no downtime. So it's really easy for people. All therapy was the next procedure that came from that uses ultrasound. And now we have kind of the next generations of radio frequency and ultrasound. So we have radio frequency microneedling, or RF microneedling, and we have kind of a newer ultrasound called soft wave. And even though we have newer technologies, the old technologies work as well. So we want to think about, again, building that foundation of the skin from underneath to help build collagen. And then we want to think about building collagen within the skin itself. So how do we keep that thickness of the skin also? And then we want to think about techniques that can heat the skin, like those techniques that we just talked about, because that will also help to thicken the skin. And then we can also add techniques that put little holes in the skin, because putting little holes in the skin will also build collagen. And those little holes can be very mild holes, like microneedling holes. We can add radio frequency or have RF microneedling holes, which are a little more aggressive, or we can go to lasers. So fractionated lasers, fractionated CO2 has become super popular these days because it can also give you some tightening with it. And those also build collagen. And if we want to take out some really big guns, we can even go back to more traditional old lasers, which have been around for a long time, like real CO2 lasers, which build a thick layer of collagen in the skin, but have a lot more downtime. So the nice thing is we have these kind of wide range of different procedures that we can use for people, and we can really customize different procedures based upon the different needs of a patient and really their different lifestyle choices. But what we know is if we can keep stimulating that collagen, if we can keep that skin growing collagen, that we help to keep you looking younger, and we can help to really slow down that clock, and we can help to hold back that aging. And that is really what's the beauty of what we can do for people.
Now, I've tried the microneedling with PRP at your clinic, and I'm a huge fan of that because, again, very little downtime. Now, but I have a question, because I have a lot of people I know, especially younger people, who, because thermage doesn't have a downtime, are just doing thermage almost every week, just all the time. Is this something you could recommend, or can we do too much of a good thing? And what is the thermage sort of, how much of that should we do? Just because I just see people doing it almost when they get facials. Yeah, let's get a thermage. Why not?
So I do think there's probably too much of a good thing. And we will also, and I'm going to say we haven't done studies, but so it was interesting. When thermage first came out, we did actually on some people do it in a series of 3 to 4. And we did see increasing results in those people. And especially for people who had kind of more sagging or more jowliness or more heaviness on their upper lids. But I don't think that people need to do that much. I think if you see results, maybe you can do a second treatment and get a little more results, but probably it's good there. And also I think there have been some concerns about kind of overdoing things as far as putting too much heat into a skin or raising temperatures too high, which if you're going to a licensed or an experienced practitioner, we shouldn't run into. But you definitely don't need to do things that aggressive that often. There are lighter treatments in Thermage, like very light radio frequency, that things like Forma or Exilis that are kind of like baby treatments, that you probably could put like a little burst of heat in the skin to get those fibroblasts to put out a little bit of collagen there, that to do probably once a month, but I probably wouldn't do weekly, because we want the skin to have a chance to recover and we want to have a chance to see results. It takes a little bit for skin to respond to things, right? So when we stimulate skin to produce whatever it is we're trying to get it to produce. So for example, with high heat, we produce collagen and elastin tissue, but it doesn't kind of see results immediately, right? It doesn't happen tomorrow. What we do is we see some contraction of the coils of the collagen. So sometimes we can see some quick results with it, but then it takes a little bit for those cells to make the collagen and for that collagen to get incorporated into the layers of the skin and then to see those results. So that's why we tell people, if we're going to even do a series of something, that we want to do it a month apart. So when we do collagen building, we want to space it out. And probably, again, for something that's a deep heat, I probably would do a series and then give it a break for maybe like 6 months, and then maybe do a single one for upkeep.
I agree with you. I think people understand recovery when it comes to muscle formation. You know, if they do weights, if you do weights every day, you're not going to put on muscle. You're not going to get the results you need. You need to give that recovery time. And I think they see with Thermage that initial contraction of the collagen fiber, and they go, oh, wow, you know, there it is. It's working. I got it. But they need to give the skin time to actually behave and make the collagen elastin. What I forgot to do is actually explain the difference between collagen and elastin. We tend to use it interchangeably, and it is more or less interchangeably. I believe that whatever more or less stimulates collagen formation will also stimulate elastin formation. But collagen is what gives your skin the almost structure, the strength, the support. And elastin is the thing that gives it the bounciness, the recoil, the elasticity, with which is equally important. And when you touched on right at the beginning that, you know, skincare, the good skincare does penetrate, you know, the upper layers, and it does make a difference in, you know, collagen formation. I'd also like to touch upon, you know, diet and what we can take internally. Collagen hydrolysate I've been a big proponent of it. I take it myself. And, you know, in the beginning, it was sort of poo-pooed by a lot of doctors, medical and otherwise, saying it doesn't work. But now actually they see that, oh, yes, it might work in helping to give the skin or the body the building blocks, right, to build collagen. Another thing we forget is a lot of us aren't eating as much meat as we used to. A lot of us are vegetarian or vegan.
Yes, in LA, that's like the very first question I ask people, because we have a lot of vegans, a lot of vegetarians, and they're not getting those building blocks that they need often for it. And those are the people that I really see the biggest change in their skin when we add supplements to it, because adding those amino acids back to them allows them to have those building blocks.
I agree. And as I said, I've got a collagen supplement coming up and a vegan collagen supplement coming up, because collagen is only found in animal sources. So what I did is matched the exact amino acid profile, but made it of collagen, but made it vegan. Another thing is vitamin C. I know that vitamin C internally, when you take it, is important because it is one of the major building blocks of collagen. What about topically? Does it affect collagen formation if you apply it topically on your skin?
So people haven't studied that. We typically think of topical vitamin C more in the antioxidant capacity, as far as protecting your skin from damage from sun, from pollution, from inflammation. But it's very interesting when we do put people on topical vitamin C's, we tend to see a global improvement in the way their skin looks. And sometimes it's really hard to know exactly what that comes from because we see kind of an improvement in so many different things. So nobody's really studied as far as collagen formation is concerned, but we do know it's very important as far as evening out pigment. Some people think that is important as far as fine lines, but we're not exactly sure what that mechanism may be. And it is very important as far as protecting your skin from damage from a variety of different, from outside assaults, as well as from internal assaults from inflammation.
Now, you mentioned that one of the first questions you ask, and that's why you're my dermatologist, and I think you're one of the best in the world, is
Thank you.
You ask people, are you vegetarian? Are you vegan? Because you want to know how much collagen they take. You know, a lot of dermatologists still don't ask that question. And you said that when you put people on supplements that give them collagen, you see a big improvement in their skin. So it's not just a fad, you would say. It is something that you think is important for people to take. And going on, what about fillers or injectables? Do they increase collagen? And maybe let's talk about, just normal fillers in the beginning, but also polynucleotides. I know they're not, if I'm not mistaken, FDA approved for use in the US, but Europe uses them. And why do polynucleotides work? Is it the collagen formation? Is it what it does?
Well, I think this is a really interesting question. So I've been injecting fillers for 29 years now. And when I started injecting fillers, we only had collagen to inject. We didn't have, well, and fat. We didn't have any of the other fillers that people use today. And interestingly, collagen went away very quickly. So people came in roughly every 6 to 8 weeks for collagen injections. But what's also very interesting is that we saw in some people, and particularly in young people, that we would inject areas and they wouldn't need injections in those areas anymore. So there was this feeling that when we injected fillers, that we put a stretch on the fibroblasts, and that caused those fibroblasts to release more collagen. And I'm going to say that, we have longer lasting fillers, and people say, oh, sometimes fillers don't go away. But I also think that when we put a stretch on these cells, and again, particularly in young people, that sometimes we get people to generate their own collagen. Because I have patients that I've been injecting for 29 years and not with permanent fillers, but often I don't need to inject places that I was injecting 10 years ago or 15 years ago, or maybe I used to inject them regularly and we don't need to inject them regularly anymore. So I think there is still some unknown mechanisms about what is happening with fillers, and whether it's that little microscopic particles are staying behind, which is possible, or we are getting some collagen build, which I also believe is possible. I think that is something that we still have to quite figure out. With the polynucleotides, I don't think anybody's figured that out either. That isn't something that I've had experience with yet because it isn't FDA approved in the US, but it certainly is a theoretical possibility that if you inject these, that they can use them as a building block to create various proteins. I think the question is, what is the direction in the cells what protein will be created, right? If we give them the right building blocks, we have to turn on the signal to make that, that block, but we don't exactly know. But patients who do it do feel that they look better.
Now, I have another question for you, and it's to do with Ellacor. I know, again, you're always on the cusp of innovation and innovative and new procedures, and Ellacor is something that you've been doing. And talk us through Ellacor. I know it's for the lower face or approved for use in the lower face, and especially useful for jowls and people, is it for does it build collagen, or is it simply a question of the fact that 8 to 10% of your skin is actually cored out, so you get that tightening? Or is it, as with many things, it could be a little bit of both? But what are your thoughts on Ellacor? Who should use it and what it does? And if anyone wants to see what it looks like, please go on Dr. Grossman's Instagram, which we will put, and have a look at the video, because, and I will say, I'm a doctor, I love these videos, but it's not for the faint of heart.
So Ellacor is very interesting because it's something very different than what we traditionally think about. So normally we're using light or energy to target different parts of the skin and heat them up, like, or focally heat things up. Ellacor is like a little tiny knife or a little baby cookie cutter, and we're cutting out teeny tiny little pieces of skin all through here. We do a lot, you know, down through the whole neck and through here. Those are my favorite areas to do. And we do some on the body as well. It just takes a little longer to heal. So it's a little bit tougher here where people tend to be a little bit more exposed. But it seems to do a combination of things that's very interesting. So one is we remove a percentage of skin. So when you do a facelift, you take out skin through here and you pull it back, right? This is taking out skin through this whole area, so you don't get any kind of interesting shifting or pulling look with it. It also removes skin from the nose and through here. So that's a very interesting way to remove volume instead of doing a lip lift where you can get an incision through here, which can be difficult for some people and doesn't always heal so well. But what's really interesting is a colleague of mine in Florida who runs a lab also has done studies on these little tiny pieces of skin. So because we're taking out little pieces of skin, now we have these little pieces of skin that we can study, right? Because normally people don't like us taking out biopsies in their face after we've done a procedure. But on these repeat treatments, we have all these little pieces of skin, and we see tremendous upregulation of growth factors and collagen and elastic tissue, much greater than we see in a lot of other laser treatments that we are doing. So we're seeing not only a reduction in the actual amount of tissue that someone has or the physical reduction of skin, but also a tremendous upregulation in all of these other things that we want to grow in the skin. So what we're seeing in patients is not only is like a shrinkage of the tissue, but a real improvement in their texture and their tone and that kind of bounce and spring that we see when we upregulate that elastin. So we see both.
So it's almost like a lower facelift and a laser treatment all in one, although it isn't a laser treatment, you know.
So it gives us, especially when we do these repeat treatments, we can get almost like laser-like quality in that skin with it, which we didn't really know was going to happen when we first started doing this. And one of the other things now is also that we've worked on some new protocols. It tends to be, as you were saying, like with the Instagram, it's a little bit not for the, you know, the faint of heart because it can be a little bit bloody. But we've worked on new protocols where we've had less bleeding and less pinkness. So it's a lot easier for patients to tolerate now.
And I will say to anyone listening, before rushing and doing an Ellacor, you know, have a look at what it is, and also to know that is it around a 2-week downtime before you can
Oh, it's
go?
much better now. It was about 2 weeks. So now pretty much within 4 days, we have people in makeup, and a little bit of it depends on how much bruising they have. We have some patients with almost no bruising. We do take people off anything like fish oil and ease and anything that can be, you know, pro bleeding. And we find that we get very little bruising. There are some patients who maybe had a little bit more to drink than they should have during the 2 weeks before, And if they get some bruising, sometimes they'll have bruising for 10 days or so. But for our patients who are really good about what they're supposed to do, they're closer to 4-ish to 5 days of downtime now.
That's not bad at all, I have to
It
say.
isn't.
And now that, and what are the, do you have any issues with hyperpigmentation, sun exposure? Is it the same as lasers, more or less?
So with these new protocols, the skin is a lot less pink. And so while the skin is pink from any procedure that you do, so whether it's a laser or a peel or a bruise after filler or Botox, right? You always have to worry about hyperpigmentation, especially in people with slightly darker skin tones or in environments where there's a lot more sun. And now, and you do have to worry about with this as well. But since we've had these new protocols, we have a lot less residual pinkness. So we have a lot less issues around that pigmentation.
And I've got another question, because a lot of lasers aren't suitable for very, very dark skin tones. Would Ellacor be suitable for even those with very, very dark skin tones?
Yes, you can do Ellacor on darker skin tones because we're not applying any heat to the skin. And the same thing for people who have melasma. So people who have melasma or that block-like pigmentation that can happen on the cheeks, over the upper part of the mouth, the chin, and the forehead, which can often be associated either with pregnancy or hormone supplementation, but happens sometimes in men or even on women who are taking medications to block hormones. We often worry about that the heat associated with different lasers that we can do can exacerbate their melasma. And because Ellacor is not putting any heat into the skin, we don't have that risk of increasing melasma through that.
Now, talking about hyperpigmentation, let's talk about your skincare line, Karyn G. I've used it. I like it. I love the sunscreen. And I want to know, do you have a specific product in Karyn NG used for hyperpigmentation? Because especially in our part of the world, Dubai, it's lovely, it's sunny, but you do have the pigmentation issues. So is there anything from your skincare line that can help specifically with hyperpigmentation?
We have a couple of products from the Karyn line that can help it with that. One of them is a serum called Bright TXA, and that has anti-inflammatories and glutathione and tranexamic acid, which is very specific towards the pigmentation. It does not use anything that is very exfoliating or irritating, so it can be used on people who have sensitive skin. We also have an illuminating mask, which has is based with an enzyme, which is a papaya or papain based enzyme. Now, I tend to like things that exfoliate, that tend to be gentle on the skin. I tend to be a bit more concerned about things that are harsh and create micro tears in the skin, because when we disrupt that barrier of the skin, it allows us, well, it actually prevents us from using other active ingredients. So this is a unique mask in the sense that it does exfoliate the skin, but it also has a lot of glycerin and shea butter. So while it exfoliates the skin, it also immediately restores that barrier so that your skin feels soft and supple immediately after, and it doesn't create any damage to any deeper layers of the skin. So some people will use that as an exfoliating cleanser on a regular basis, or they'll use it as a mask somewhere between 5 and 10 minutes, somewhere between once or twice a week to help with it. And sunscreen is actually the most important thing that you can use for pigmentation. Our Karyn Complete is an SPF 50, and it's done just with physical sunblocks. So just with zinc and titanium, but it also has iron oxides in it. And what we have found over time, and most recently, is that those iron oxides, especially for people who have melasma, that blocks visible light. And that is also something that is important when you're trying to treat people both with melasma as well as pigmentation that can happen after procedures. So post-inflammatory hyperpigmentation from all types of different types of procedures that people can get. That addition of iron oxides into sunblocks, so these pigmented physical sunblocks, are very important.
Well, I have to say, I can't wait to use your enzyme peel because I've closed down my current skincare line until I launch a new one. So I've been looking for an enzyme peel, and I'm in LA, so I'm gonna use your ones. I know that you use the Provert complex, and it's a complex of echinacea, Indian gentian, and licorice. Now, being an integrative medical doctor, I use licorice a lot. Internally, I use it for upper respiratory tract infections, sore throat, peptic ulcers, echinacea, of course, when you're coming down with a cold and flu, it's great. And I love the way you use both cutting edge medical, um, ingredients, but also natural. And is isn't your line almost 90 to 95% natural origin?
Yes. So when I created this line, I created a line and that I've turned 90% natural and 10% science. And I created that because I felt that I wanted to have natural based healthy ingredients for my patients, but that a lot of my patients were a little impatient with getting results, and that I wanted to be able to add a tiny little bit of extra science into it to try to increase some efficacy in getting people to the end point where they wanted to be, but at the same time being very aware and very conscious of staying away from any kind of controversial or concerning ingredient, so that this science is very kind of carefully curated, so that I'm very careful to make sure that everything is very clean and healthy, even if it's not 100% natural.
I have a question because that's a question I always used to get. I feel that people like to maybe complicate their skincare routines, although they really don't need to. So from your product line, what would you say are the basics for someone, say, in their 20s who just wants something basic, who'll see them through? And then someone maybe like me, now you know me, someone in their 40s who wants to prevent pigmentation. I've got a little bit, thankfully not so much, but you're talking about wrinkles, fine lines, pigmentation, large pores, and the droopiness is starting. So maybe what would a 40-year-old use from your line?
So when I designed this line, I wanted to make things also relatively streamlined. So I have a full-time practice. I have now an 18-year-old and a 20-year-old who were younger when I started it, and I'm a single by choice mom. So I have my kids full-time and have to take care of them. So I wanted to make things simple for people who wanted to have things simple, and have an ability for people to layer in things for people who wanted to do even more. So step number one, and kind of the most simple, is that Karyn Complete in the morning. That product is an SPF 50. It's a moisturizer. It's an antioxidant. It's anti-inflammatory. It is anti-aging, and it serves both as kind of a nice light makeup primer, as well as gives you even color to your skin. So some people use that as their makeup foundation in the morning. So if you want to do only one thing in the morning, you can do even just that. Now, a lot of my patients are like, I want to do a little more, or they have bigger concerns. So if you want to do more in the morning, you can layer in, a vitamin C product to work on pigmentation, or an antioxidant peptide product to work more as an antioxidant and more kind of plumping or an HA product to add in hydration, or an HA stimulating product to add more HA growth into your skin. And then in the evening, you can add things to work on problems. So the Bright TXA to help on pigmentation. We have a very nice retinol product that can work on fine lines and wrinkles and pores. I get a lot of concerns and pushback from patients about retinols, although for me and many dermatologists out there, retinols are still the gold standard. And that's because retinols work on multiple layers of the skin. They exfoliate and help the top layers of the skin turn over. So they help with pores and congestion and fine lines and helping to smooth out the skin. But retinoids also help to build collagen in the deeper layers of the skin, which is why dermatologists often really like retinoids. But people can be sensitive with retinoids, particularly at the prescription level. So I've microencapsulated these retinoids. I've added a lot of anti-inflammatories to this to help to allow people to tolerate this, because we know that the key to success for use of retinoids is to use it on a regular basis.
I have a question, sorry, about the retinols and retinoids, and especially the one that you have. Is yours prescription?
No, it's not prescription strength. But what we know for anti-aging is that we actually don't necessarily need prescription strength to get results. Now, if you have acne, sometimes you need to go up into prescription levels, and you may need to climb and get higher and higher prescriptions. But for anti-aging, the trick is consistency of use. For acne too, but for anti-aging, the trick is consistency of use to trigger that collagen production, in addition to that epidermal or that top layer of the skin cell turnover. So we can use milder products and build in ways to help people tolerate those products to get that consistency of use to get people results. So
Now,
I've built in.
I'm a doctor and I know the importance of retinol. I know a lot of people have pushed back and said it causes cancer, it causes this. You just, I don't believe in that. You just have to be careful when it comes to sun exposure.
But you know what? Everything we do, and almost everything that we put on somebody's skin, is going to cause them to have sensitivity to the sun a little bit. And the truth of the matter is if you want to take care of your skin, if you're taking and putting the time, energy, and money to use products, you need to be careful of the sun, right? That's always step number one. I tell patients, sunscreen, if you're going to do one thing, it has to be sunscreen.
I agree. But when it comes to retinol, I just couldn't use prescription strength. So I had to formulate my own using retinoids that I was able to use again every single night. And I thought it was wonderful. I don't agree with using retinoids or retinol. And I mean, retinol, you shouldn't use it in the morning, but I don't even agree with retinoids in the morning. I think that sunlight just, isn't good for it.
It go away. It deactivates them.
So, I keep it for at night, only at night. I want to also touch base on things that people can do at home, because with the advent of in-clinic lasers, of course, there's at-home lasers, and they tend to cost around $500 to $1,500. And there are two in particular that I really get asked about, and it is Lima, which is basically LED. I don't know why it's called a laser. It basically is a infrared light beams. I would like to know what your thoughts are on LED and red light treatment. Do you offer it in your clinic? And for me, my personal opinion, but I'd like to know yours, is that LED is something that can be used at home, can be used effectively at home. It's not necessary. Maybe if I'm going to go to a doctor's office and spend money, I'd rather do the microneedling, the lasers, the Ellacor, the thing, and the, injectables, even the things that I can't do at home. But LED, but then again, there's LED that is like, oh, that's not going to do anything. It's just far too weak. And then there's like proper LED. And I don't like the handheld treatments because it's going to take you ages. Just get a
You're going to be
squeeze.
there for 2 hours doing
Exactly.
10 minutes here, 10 minutes.
It just shows marketing and what it can do. So I like, I buy mine from Red Light Man, and it is about 100 milliwatts per centimeter squared if you're 40 centimeters away and you can do the full body or you can do the face. So
So
that's my opinion on LED.
there
But
is
what's
good
yours?
science on LED lights and low level light therapy. And most recently actually for hair growth, right? It's very interesting, that science. That science is very old, as a matter of fact, maybe 15 to 17 years old. And they did very good studies that looked at this. And interestingly, the science is very comparable to what we get from very good, effective skincare. So is it what you're going to get at a clinic with a laser or something that's more aggressive? No. But is it nothing? No. Now, but that being said, again, like you were saying, you're going to need to do like a big panel, or you're going to need to really sit here for an hour every day and do these small handheld devices, because it comes down to consistency, right? Because you do get some activation, and they looked at these things. It was a very elegant study that looked at these things. They can be helpful in dermatology clinics after certain procedures and decreasing inflammation a little bit. And you can get some help for them at home. But again, you need to use it, and you need to use it consistently. But, for some people, is it worth $1,000 or $1,500? Maybe, because if you're spending that much in a year on skincare, or a month on skincare, maybe it's worth the trade-off. I don't know. But if it's something that's going to stretch your budget, or you could use that money for a bigger procedure at a dermatologist's office, you're going to get probably more bang for your buck out of a bigger procedure at a dermatologist's office.
Agree. Now, let's talk about the NIRA laser, NIRA. Again, I could be, tomatoes. I don't know how to pronounce it. It's a non-fractionated laser therapy, FDA approved for use at home. And in my mind, of course, I'm not the laser expert, you are. In my mind, it's almost like a baby. Is it like a baby thermage where it heats the skin? And is it something, even if it is a baby thermage, is it something we should be doing 3 times a week or once a week for the rest of the year?
There's a whole bunch of these different things that you can do at home now. There's home IPL, there's home fractionated lasers. And again, it's these very little incremental things that we don't exactly know. So these home laser hair removal, again, definitely works, but you're going to spend hours and hours and hours doing it. But if you don't have access or the finances to be able to do it, it might be worth if you have the time, as long as you're the right skin tone. These other things, I think what people are trying to figure out, and again, we don't exactly know the answer to, and people are beginning to think about, is we know that putting this like energy into cells and stimulating this collagen turnover or these outputs gives us improvement. But is there too much to it? And do we get cell fatigue, or do we end up building up damage? And that's kind of questions that are just beginning to come up that people are thinking about, and we don't really know. So like there's a new company that's out called Cell Sound that's been available in Europe for a little bit and is just coming to the US. that uses non-heat to stimulate muscle contraction and to stimulate collagen production and the release of fat in cells without causing this like little bit of micro damage, and looks more at cellular regeneration, because they're saying, is there a potential problem with this kind of constant knocking at things? So I think this is, kind of somewhere where we're heading, and we're not 100% sure where we're going. And are we giving ourselves enough time to recuperate and to recover? And I think this is kind of a whole new frontier that we need to look at. Our bodies are really interesting, as you are certainly better at forefront of exploring. Our cells, we have cells that die every day and new cells that grow every day, right? And where's that balance, right, of too much and too little?
I agree. I think half the reason that, I look so good, I think, at my age is because I've really allowed my skin to heal. And I haven't been uh too strict on my skin. Like, some days are bad days, some days are good days, and I know that people want perfection. And when you try and go for perfection, you can sort of overdo it. Like, some people want absolutely poreless skin. That's a lot of acid you're using if you want absolutely poreless skin out every single time. So you need to, there is something called just, giving up, or your skin says enough is enough, and then you get it reacts, and you get skin reactions, you get skin sensitivities, even to the smallest things. So I think a lot of people want this glass skin, this poreless, this wrinkle-free face, but what they are not looking and thinking of is, don't you want strong skin and resilient skin too? And if you do, you've got to take care of the skin barrier, like you were saying, that your products have things that also will take care of the skin barrier, because that's super important to have strong skin. Another thing I'd like to ask you about is, what are your favorite tips that you do, and that you would like other people to know that you do for skin, that they can do at home, or they can buy from the drugstore or something? And we hear it all the time with TikTok. Is like, oh, preparation H, and I'm just like, no, don't put that under your eyes. I mean, it'll work once, but no, it's meant for somewhere else, and there's a reason for it. Your eyes are going to suffer. So a proper, we need more doctors to give us more TikTok tips, instead of leaving it to people who maybe don't know very much about the skin.
I think it's really funny, because I think a lot of kind of my little homemade remedies are things I actually got from my grandmother, of all things. And there's so many things that you can do that you can actually get from your pantry, that you can, help your skin, and that are safe and that are easy to do. So just to help hydrate your skin, you can take an egg, and if you have oily skin, you can use the egg whites, the protein and the lutein in that, make like a nice mask that is easy to do, has no toxins in it, is healthy, will give you like that, like nice, like smooth glow. You can mix it with a little bit of olive oil. If you have really, use the whole egg and mix that with a little olive oil. If you have like dry skin and you want to hydrate. My grandmother used to take, I don't know how she knew about coconut oil like so long ago, and like put that around like the cuticles. But there's so many like little things that you can just take like from little bits and pieces from nature and pull that in. green tea, like real green tea bags with caffeine, are great depuffers. Like if you've like waking up early in the morning, take those tea bags, stick them in the refrigerator with some water and some ice cubes, and then kind of sit upright and put them on your eyes. That both the caffeine and all the different antioxidants in the green tea itself will help them kind of help to depuff. So there's a lot of kind of cool things you can just get from like your refrigerator and your pantry.
Now, last question, because we're almost out of time, but hair loss is a big thing. Every time I do a video on hair loss, it gets the most views. And so I talk about, aloe vera, castor oil, rosemary as natural ways for hair loss. But how about if someone wants, like, just has a little bit of a bald spot, or like, as you age, your hair does tend to fall a little bit more. And, we talk about eating enough protein, eating enough, again, collagen and vitamin C, and exercising and stress is really important. But I know, or dealing with stress is really important, but I know that in your clinic, you do offer hair loss treatments. And I'd like to know what they are. I know what they are, but would you please tell everyone what they are and what they're used for? Because some people have just a little bit of like a bald spot here that they want, and some people have more diffuse hair loss that they just want it to be a little bit thicker, like in their 20s, or are they being a little bit too, should you just leave it if you don't have any bald spots and it looks okay? So I'd like to get your opinion on hair loss in general.
I would say the first and most important thing is if you're a relatively young person, is to make sure you get that hair loss evaluated. We have turned up several underlying medical conditions on people that need to be addressed, including problems with iron and thyroid and lupus. So you want to make sure that you don't have a health issue, especially if you have a true bald spot. But people in their like 20s and early 30s probably shouldn't be having that much hair loss unless you have pretty strong genetic hair loss. But a lot of women starting at around age 35 start to get a little kind of aging hair loss, which can be associated with that kind of perimenopause, even though you're not close to menopause yet, right? And how we think about men, getting bald, women can start to get that in their 30s. So obviously, diet is the first place that we tend to start. And for people who are seeing it, we really talk about topicals and supplements to start with. So there's a great product called Care Factor that is a combination of growth factors that was developed by, of all things, a very good laser engineer who's super smart and very scientifically based and has done lots of studies. And it's something that's very cosmetically elegant, so people like it. And we use that often in a microneedling treatment and in combination with PRP injections. Some clinics also offer that in combination with exosome injections, which are very similar to PRP. PRP contains exosomes, and you can kind of think of all of these things as fancy little growth factors that kind of stimulate your hair to grow. These, as I mentioned earlier, low-level light treatments of therapy caps, that is one area where there's very good scientific study to show that does help hair to grow. Supplements also can be helpful. So a lot of the supplements really look at vitamin D and C and B12 and iron, which are often the levels that are low in people who have kind of nutritional deficiencies that are related to hair being thinner. As they also can have some herbal things that help to modulate hormones. And then we may need to supplement, again, people who have low collagen intake for whatever reason, with some kind of collagen supplement as well. Interestingly, as of a few weeks ago, there is another new treatment that's coming onto the market that is a laser, which is a little different than some of the other laser treatments that are out there, which historically need to be used in combination with some topicals to grow hair. But there's a new laser that is putting heat a little bit deeper into the skin, which, again, kind of from a holistic view, is causing growth factors. It's kind of a deeper energy. And what that wound is doing is causing growth factors to come into the area to help to stimulate the follicle to grow hair. And they are getting some very, very good results with that. So that is going to be kind of a new and exciting hair treatment that is also going to be up and coming within the next months.
It's interesting you said young people usually have, you look at iron deficiencies, because I've just launched an iron tea. Because of that, a lot of young people, even men these days, have low levels of iron and they don't realize it. They just feel a general fatigue, and no one's saying, oh, iron. It might be iron, because again, just like vegan, vegetarians, when you don't eat enough meat, your iron levels tend to be low, especially if you're a woman and you're menstruating. So that's interesting you said that. Now, I'm sure my clients and people who are listening want to know LED caps, because I've heard that LED is great, and a lot of doctors do recommend these LED caps that you can buy. I think 7 years ago, they were about $1,000. They're quite expensive. So that's why, again, with LED, it depends on intensity, because you don't want to be spending time putting something on or buying something and putting it on and it not working. Do you have any brands of LED caps you recommend? If you don't, that's fine. But if you do, I'm sure everyone would appreciate.
Yeah, so there's two caps that we tend to recommend. One of them is the Cara Cap by Cara Factor, and the other one is Capillus Cap. And these caps are expensive. But what I tell patients is, if you look at the cost per treatment, they're not only reasonable, they're very cheap. These caps will last for years. You use them daily. And if you think about like the cost per treatment, it's very small. And you stick them on your head, you can do some email or work on your phone, you push a button, and it's like 6 or 7 minutes a day. And again, that's one of those things that has some good science for it. And is very easy. And again, it does have an upfront cost to it. But if you think about that, you're going to use that particular cap typically for about 6 or 7 years, because I mean, we've been selling them for that long and people have not brought them back in and saying that they're broken, that's actually ends up being a good investment.
I have another question, because my hair, me, would a cap be good for me? Because, my question is, people with short hair, yes, I can see how the light would actually penetrate.
Yes.
But people with hair like me, and I don't have any, bald spots, everything's nice and thick, thank God. But is it something that someone like me should buy or could buy?
So it's kind of interesting. And what I will tell you is, clearly people who have more scalp show, that light is getting onto the scalp. So I've asked a couple of my friends who just do hair about this, and I have a fair amount of hair, right? But I have probably lost, because I'm 58, about 50% of my hair that I had from before I went through menopause. And I was like, about using a cap, and my hair specialist friends have like used the cap, some gets through, and it did help. So while I was a little incredulous about it at first, I asked and asked and asked. I kept getting the same answer, and I used it, and it did help. So I am on the cap.
Okay, so am I. Okay, that's it. I want that actually was a question for me, basically. But anyway, our time is up, and I could have gone for hours with you. As as you know, because when we see each other at your clinic, we're usually, I feel sorry for whoever's after me because they're going to be late because we're just talking and talking and talking. Thank you very much for sharing your
Well, thank
knowledge
you for having me.
and your expertise, and honestly, and thank you for what you do, not only for me, but for everyone. And thank you very much. I'm very excited. And I can't wait for everyone to listen to this wonderful conversation that we've had.
Thank you so much. Thank you for having me.